just because he's been sitting and doing all the kind of IT stuff out in the lobby there. So we're going to get him treated, and we are basically just going to kind of demo some of the things we provide here. So earlier on Tuesday, I spoke about like the cupping, the grass, and the laser therapy, some of the stretching, and we're just going to kind of go live demo here. So first things first, you want me to get the table up, or you just want to go face down? Okay, so we're just going to start face down. And guys, what I'm going to do here is while I'm treating Phil is just basically kind of walk through everything that we're doing to him and explain. So we're going to pull this up here. Just going back to yesterday when we do the laser, we need to do it skin on skin. And just with Phil's job here, sitting for prolonged periods of time, and Dr. Orbach actually talked about posture and breathing pretty darn good about a couple hours ago. So we are basically going to kind of go in and release all this soft tissue that Phil is basically taxing and putting tension on from being in the seated position all the time. So the first thing we're going to start is what I do with a lot of patients is our CBD is fantastic. It got the lipodermal transdermal technology, so it's actually going to get into the tissue, and CBD is a natural anti-inflammatory and a neuroprotectant. So usually when I kind of do some laser therapy on a patient, I'll put that on first just because it just makes my job a little bit easier. So next, what we're going to do is we are going to start with the laser therapy over Phil's back. And let me just kind of roll this puppy in. And this is what the laser looks like. This is the Rolls Royce. This is an Aspen Pinnacle laser. And I don't know if you could see it on my hand, but it just has like a red light. That's basically all it looks like. And the only byproduct from the laser therapy is heat. So what we are doing, just to kind of reiterate what I went over on Tuesday, basically the easiest analogy for the laser is when sunlight hits a plant for the plant to kind of grow and heal, we are donating photon energy to the tissue in Phil's body so he could basically heal 100 times quicker than what he normally would. So we are creating an increase of nitric oxide and O2 perfusion across the cell membrane, and it's going to allow for ATP production as well. So we're just going to get this hot laser over Phil's back, and we actually use the heat to our benefit. So once collagen, so all the skeletal muscle in Phil's back is all collagen based. Once we get it heated to around like 101 degrees, it becomes a little bit more pliable or mendable. So same kind of principle as if you're going to try and bend cold rubber as opposed to hot rubber. It's just going to make it a little bit easier to kind of work on the tissue for Phil. And again, he is sitting at a desk basically all hours of the day. And so what happens is how Dr. Orbach was talking about, sitting at a desk, head goes forward, you get that anterior head carriage, and then your shoulders kind of round and everything just kind of sinks and droops kind of like this, right? So what we're going to do is he puts a ton of tension on these muscles. So we're going to do kind of all the therapy to loosen this back up here for him. Not too warm? Okay. And so it depends on the patient and depends on the pathology at hand, but usually like the laser treatments, anywhere from like 2 to 5 minutes. Neuropathy setting, we go a little bit longer just to kind of trip that calcium ion channel on the nerve. And if it's kind of like an acute muscle strain or joint sprain, a little bit longer as well. If it's kind of just like a chronic patient coming in, we don't have to get as much photon energy into the tissue just to kind of to get the therapeutic relief. So we're just going to get Phil nice and warm here. Are you in any active pain?
Not really, just lower back is uncomfortable for sure.
Okay. Okay. And I can't speak enough of the volume of the laser. Like, this is no joke, changing people's lives. Shoot, I think, Phil, you were here when I actually had a patient in. One of his main things was he couldn't grab a pen to sign his name, even to check out. And he signed up for the laser treatment series. And just based on his findings when I kind of went through the exam, I didn't know how much we were going to get out of him. He came in after 2 treatments and he was able to grab the pen and sign his name, and he was tickled, and that makes me feel great. So that's pretty crazy just after 2 treatments. So
I remember I was checking him out, and he was like, no, I got this. Like, he was writing the check. He was like, I got this.
Yeah. So, I mean, that's crazy. Just what it does, again, at the cellular level, just increases ATP, nitric oxide, and it's to be honest with you, it's a lifesaver for a lot of people. And again, makes my job a lot easier. So, okay, we got Phil nice and heated up here. So what we're going to do is we're going to kill the laser, And I don't know if you guys can see my face. You have to wear protective goggles if you're in the room, just so we don't have any of that photon energy bounce off of anything, just so it doesn't go directly into your eye. So, and I'm going to walk up to the camera. What we're going to do next is, this is called the Graston technique, or instrument assisted soft tissue immobilization. So what we're going to do is, since he's nice and warm, we're going to kind of go over the tissue in his low back. It almost kind of feels like a deep tissue massage. So since he's seated, basically 40 to 50 hours a week, what happens is some of that collagen kind of gets tangled up, and then you got trigger points. So since he's nice and warm, and we kind of go over with the Graston tool, we're just going to allow his myofascia to organize more linear to take the tension out of his back. So a little cold here. And then the product that we use, just for any kind of like lotion or lubricant, we use the China gel. And the China gel, I always tell patients before I put it on, hey, you're going to feel like a little bit of cooling on your back. No, it is not a bad effect. So it's just a little bit of like a cooling gel here. So, and then what happens with the scraping as well, like the muscle scraping, you basically get a little red. So what we're trying to do is stimulate the blood flow to the area, not only from the laser, but with the Graston technique, just so once you get all this blood to the area, it's just going to allow them to heal a little bit quicker too. So this works for any kind of like muscle complaint. Bicipital tendonitis, Achilles tendonitis, any kind of chronic low back pain. Just because, I like to tell people if they have them, these are called your erector muscles. So they're the stability muscles of your spine. They actually start down here on your aponeurosis, down kind of by your tailbone, and then attached to your skull. So a lot of times people were coming in with low back pain, and they're like, yeah, doc, I've had off and on low back pain for years, and now it really grabbed me. When I take my chin to my chest, I feel pain in my low back. Why is that? It's because everything's connected from the sacrum to your skull. So if you take your chin to your chest, it's putting more tension on these erector muscles up here. And if you already have pain in your back and these are already tight, you're going to feel that sensation too. So not only, since Phil's having a little bit of low back discomfort, but we're also going to treat the upper back as well.
I gotta say, I already feel better compared to 5 minutes ago.
Yeah. You've been sitting a lot this week. Yeah. So we're going to get this all loosened up for him. So, and then what we're going to do next is just to kill two birds with one stone, because I try and do as much as we can in a treatment segment. I'm actually going to put a couple of those cups up top on his thoracic erectors. So we got our lumbar spine, thoracic spine, and we're going to put those cups on the upper half, just to kind of draw blood to the area again so he could heal quicker. And since his low back is tight, when this gets tight, it's putting tension all along the chain. So that's why even with a low back complaint, I like to treat a little bit higher up too, just so we could get everything to release. So let me grab a couple cups here. All right. And what I was talking about in my presentation on Tuesday, there are a couple different techniques when we're doing cupping. So right now, this is basically just called static cupping, and this is a dry cupping technique. Wet cupping, wet cupping is when you actually kind of like draw blood and then you pull the blood through the cup. We do definitely not do that over here. This is just all dry cupping. Let me put one more on here. And then the last one here. Perfect. Okay. And then next, what we're going to do is, I like to use this. It's called a hypervolt. It's kind of like a percussion gun. And the reason why this works so good is every single muscle in your body has this called a GTO, a Golgi tendon organ. Dr. Orbach prior today was talking about the muscle spindle. So when we rapidly tap a muscle, it sends an afferent stimulus to the brain and an efferent stimulus back down to the muscle and forces it to elongate and relax. So a lot of people, even just after having this percussion gun on them, they're like, doc, my back feels a ton looser. It's all neurological, all neurology. Yeah, Phil, your erectors are pretty darn tight right now. You got like 2 steel cables running through here, and you're not having any low back pain running into your lower extremity. No pain in the glutes, hamstrings, foot, nothing like that.
I don't know, maybe like left hamstring actually.
Left hamstring? Okay. Okay.
Not really that.
Okay. All right, and the reason why I asked Phil if he has any kind of low back pain running down any kind of lower extremity, either right or left leg. That's basically the technical diagnosis is like a lumbosacral radiculopathy. It could be from like added compression in his back, and it kind of flares up a nerve, and then you feel symptoms run down. So what we're sorry guys, that was probably really loud. So what we're going to do next is so some of that trigger point release. So this is all basically it's called pinning and stretching. So what I'm going to do with Phil is I'm going to bend his right leg, and we are just going to be moving his leg out here, and then I'm going to put a little bit of pressure, and it's called, this is the piriformis muscle. So this tends to be a pain in the butt for a lot of people. And so what we're going to do is we shorten the muscle, pin it, and stretch it back out just to make the muscle a little bit longer. And the reason why I work on the piriformis muscle, only is it going to relieve any kind of tension in his glutes, this will actually help with the low back as well. So even though the source is the low back, I always like to treat above and below just to help with the symptoms. But what comes first is definitely going to be the low back here. So we're going to go a couple more passes here. Feeling all right?
Yep.
Not too much pressure? We're going to go a little harder here. So real loose. I got you here. All right, so this is basically all called that active release or like pin and stretch. So this is just one of the soft tissue, therapies that I do. People benefit great from this. Basically, we're just trying to make the muscle belly a little bit longer here. Now I'm going to check on the camera, and we are still going to be good to go for the hamstring. So I'm going to scoot this laser back just a little bit more. And then Phil, you can stay real loose here. And then we're going to work on this hamstring. So same principle. We're basically shortening the muscle, pinning it and stretching it back out just so it gets a little bit longer. And how your hamstrings tie into your low back, this is an important point. A lot of times I get old athletes that used to play whatever sport when they were in high school, college. If you have tight hamstrings, your hamstrings attached to something called your ischial tuberosity. It is basically, some people call it the sit bone, your butt bone. So Phil, I'm going to kind of touch your glute here. It's located right here. So if you have tight hamstrings where they originate, what happens is that is going to be pulling on that ischial tuberosity and actually rocks your pelvis back and loads your low back and puts more pressure on your low back. So a lot of people that are coming in their 30s and 40s with any kind of low back pain, it's not uncommon when you ask them, have you ever had tight hamstrings? You ever pull your hamstring? And most of the time the answer is yes, and that is why. So any kind of low back complaint, I also like treating the hamstrings as well, just so your pelvis is sitting right. So we're going to go 2 more here. Last one. Good. Okay. So I'm going to pull this up, Phil, and then I'm going to pull these cups off of him. And then what we're going to do is, since he is pretty darn tight, we did the laser and the Graston technique, but right now what we're going to do is we're going to do like a sliding cup. So this is just another efficient way to kind of just release all the tension in his low back. So a little bit of China gel on here, and then we're going to put a cup on, and then I'm going to kind of be moving it. So, and a lot of times when I'm doing this with patients, I call them speed bumps. You could almost kind of feel like that myofascia, so that connective tissue kind of just sliding under the cup. And so this is just another way to just kind of release the tension here. So we got a lot of bells and whistles over here. So a couple more here. Feeling all right? Actually, Phil, this is not feeling too bad right here. Has your back pain been waking you up at night at all?
No.
Nothing? Hard to fall asleep?
No.
What about getting in and out of your vehicle?
Nope.
Totally fine?
Yeah.
Okay. Sitting, is it like a dull toothache, or is it a sharp pain?
Yeah, like in the background,
Okay. Okay.
And it's not like all the time either. It's just like sometimes I'll notice it and be like, oh, damn, like my back really hurts.
Okay. I don't know if anybody else could hear Phil, but he basically said, he just kind of notices it. So again, he's in the seated position for a while. And when you get in that seated position in a while, it's going to put tension on those lumbar erectors. So he said basically when he kind of moves around, he'll just be, he'll just be aware of it. So what we're going to do is we're going to hit this other erector muscle here. And then we are going to kind of go into like a little bit of a deep tissue massage here. And then we will get him adjusted as well. So. And just another clinical pearl about the low back too. So a lot of people, I'm seeing low back pain, 3-4 patients a day, depending on the day. But a couple of different things. So a lot of people will either come in and they'll be like, hey, doc, my hip's out, or hey, doc, I think I slipped the disc. When we talk about disc properties, you have the most compression on a disc in the seated position, the second most laying on your belly, just how Phil is, the third most standing, and the least amount of pressure on a disc laying supine, so laying on your back. So there is a lot of times when people come in, and I'm just looking for like just cues. So if your back hurts a ton when you're in the seated position or laying prone, could that be indicative of a disc pathology going on? It absolutely could. So that's why when you come over here, especially new patients with any kind of low back pain, we do a full neurological exam, both myself and Dr. Orbach. So we're going to check deep tendon reflexes, myotomes, dermatomes, just so we can kind of hone in and see exactly what's going on there. So that was a little bit of that the sliding cupping, or like I call it the transdermal cupping. So again, we're just trying to stimulate more blood flow to the area so he could heal natural as quick as possible. So all right, and I'm going to pull this back down here for you, and then we are going to see how everything is feeling here, Phil. Not bad in here. All right, sir. So let's drop these arms down here for me. All right, sir. Let's go deep breath for me here, and press all the way out. Easy. Very good. And deep breath for me, and all the way out. A little quicker. Good. And last one for me, Phil. And all the way out. Little push here. Beautiful. Okay. So I'm going to put this down here, and then we are actually going to get you up and flip you on over here, and then we're going to stretch your legs a little bit, okay? All righty here. Sorry, that table's a little short. All right, so I'm going to make this a little bit higher, and then you are going to flip on your back when you are ready here, sir. All right. It's very quiet in here without any kind of music.
I know.
It is. All right. So what we're going to go over next is that was basically like all the soft tissue therapy. And so now what I like to do too is we were talking about the tightness of the hamstring. It's essential that we loosen up all the muscles that attach to the pelvis just so the pelvis is sitting completely how it should be. So what we're going to do first is we're going to bend this knee. And this is basically, they call this like fascial stretch therapy. So what we're going to do is we're going to loosen up. It's a group of muscles called the external rotators of your leg, like it's in your glute there. So I like to loosen these up with any kind of low back pain. Just you're going to get a better response here. So little stretch here. Camera good. Good here. And so what we're working on now, when we were talking about using that percussion gun to stimulate the GTO, right now we're kind of stimulating that GTO just a little bit and that muscle spindle. So basically we're trying to work on the, neurologically, we're trying to work on a system just to put more length in these muscles so they're not so dang tight. So a little stretch here. And what we're going to do next, Phil, is you're going to push your knee into my hand. So push in and relax. And let's push and relax. Last one, let's push. That's strong and relax. Pretty darn strong there, Phil. And you're good. So,
relax or push? I don't know.
no, a little hold here.
Okay.
Good stretch. Okay, now we're going to go straight leg here.
Yeah, my upper body's kind of, but my legs are straight.
Yeah. All right, nice little stretch here. So again, this is all, this is kind of like FST, fascial stretch therapy. So what that basically means is when we talk about the myofascia, your myofascia is basically like connective tissue. It's like a pantyhose that wraps around the muscle. You're going to push down into my shoulder and relax. Very strong. Let's push here and relax. And let's go last one here and relax. And nice little stretch here. So what we're trying to do is, we're basically trying to unwind the fascia if everything's really, really tight, just to make, again, we're just basically trying to create space and just loosen everything up so his pelvis is aligned properly. So,
That's so good.
yeah, we're just going to loosen his legs up here. And then what I also like to do with Phil when I treat him is since he's working from a computer, we're talking about that upper cross syndrome, right? So when you're in the seated position, everybody, they might start here, but then the head goes forward, shoulders roll, and everybody's typing on the computer like this. So I went over Tuesday about a couple different stretches you could do, and Phil brought up the video with all the mid-back stretches. So what I'm going to do is work on the soft tissue to kind of get him up, and then he could start doing his wall angels, the TPI stretch, and the thread the needle and everything. So I'm going to take this arm here, and you're just going to go real loose for me, and we're going to work on the pec. The main reason why we're going to work on the pec is your pec actually attaches to a bone up here, and if the pec's tight, it's going to naturally roll your shoulder in. So we get a lot of benefit if we actually work the pec out, that the shoulder naturally rolls back. So we're going to work this puppy out a little bit here. And you usually don't have too much upper back pain or anything like that?
No, yeah, it's usually lower back. Yeah.
Have you been climbing?
Yeah.
Yeah?
Mm-hmm. Yeah.
Your forearm been all right?
Yeah. I mean, I took a little break for like a couple weeks, and then going back was like that same kind of feeling.
Okay.
But
I remember you tweaked was it your forearm or your elbow a couple months ago?
It was I can't remember now. It was like my elbow or my forearm.
I think it might have been your forearm. Like when you stretched it, you felt a little bit of a pain.
Oh, yeah. When I was opening and closing my hands, it was really like...
That's what it was. Yeah. That's what it was.
Yeah, that was... Yeah, you made it better in a few days.
Yeah. Couple treatments. That's usually all it takes. Yeah. Yep. And just real loose here. So that was working on his pectoralis minor muscle. And right now we're kind of going to, it's called his subscapularis, or like a part of your latissimus dorsi. I love working soft tissue. Don't get me wrong, chiropractic comes first, like adjusting everybody. But just my philosophy is, if we adjust certain segments on his body, right, or and like everything's sitting pretty, all your soft tissue attaches to an osseous structure, so attaching to a bone. So if we adjust the bone and don't do any soft tissue work, and you have like tight, unbalanced muscles, what's going to happen? Everything's just going to kind of get junked up again or just go back to normal. So that's why I feel like 50% of it is actually working on the soft tissue as well as getting the spine and the extremities adjusted there.
That's good.
Yeah, good little stretch there. All right, and then we're going to work forearms because you've been on the keyboard a lot here. So real loose, I got you. You're getting a little bit of an overhaul today. Yeah. Not too bad.
Not too bad.
And same thing. So like, even if you don't have any numbness, tingling, anything running down to your hands, Phil's on the keyboard a ton. We want to prevent that, right? So what we're doing right now is the same kind of the pin and stretch to make these muscles a little bit longer because they're pretty darn tight on them. So these are called your flexor digitorum muscles. And a lot of times when people say, Doc, I got the carpal tunnel, my hands going numb and tingly. Could it be coming from these muscles? Yes, but more importantly, it could be coming from this muscle right here. This is called your extensor carpi ulnaris. I'll actually demonstrate on the other arm, might be better. So it's basically this muscle right here. So what we do is we basically shorten it, pin it, and then I'm going to go back to the other side, Phil. So what we're going to do is we're going to shorten it, pin it, and stretch it back out. And what I was talking about yesterday was if someone goes for a nerve conduction study and they have 0 to mild carpal tunnel syndrome, almost guaranteed it's coming from up top, like your neck, or it's coming from this muscle right here. So we get great results with any kind of carpal tunnel syndrome if it's not like a severe carpal tunnel. And then especially if you're having any kind of numbness or tingling running down in the hand, I like to do something called like a nerve floss, a neuromobilization. So what we're doing is we're going to go straight arm here. And then Phil, you tell me when you feel any kind of stretch, either your wrist, forearm, or elbow. That's pretty good. So basically what this is doing is we're trying to floss the nerve from his neck all the way down to his hand. So how I explain it to patients is we're trying to put more slack in the rope. So it's very common that someone comes in with any kind of neck pain running down to their hand, and their hands going numb, tingly, burny, any kind of nerve sensation. So basically what happens is you have inflammation around that nerve root or the disc in your neck. And so what we're trying to do is just kind of floss that, because sometimes you could get some mild adhesions on it. So I call them spider webs. So So we're basically just trying to break off the spider webs so that nerve is moving through its full range of motion correctly, so you don't get any of the pain running down to the hand. So people benefit great from there, from that stretch. And then stay tuned. Me and Phil got a couple videos for next week, and one of them is basically just going to be a ton of nerve flosses. So if you have any low back pain running down a leg, or if you have any neck pain running down your arm, we're going to show you basically on our Instagram, which is World of Wellness PGH, and on Facebook, we are basically going to show you different stretches that you could do at home just to kind of alleviate any kind of nervy symptoms running down here. So, all right, last thing, let's get your hips adjusted. So you could roll on your side and face me over here. And we are going to go bending this knee here, sir. And I'm going to take this arm, big old pull, big old hug, and just a little drop coming here. So just easy, easy. Perfect. Okay, let's go to the other side here for me. Yeah, that was
like a chain reaction.
That definitely needed to move, Phil. And so we're going to bend this top guy here. Big old pull, big old hug, and just real loose here for me, Phil. Just quick, quick. Perfect. Okay, on your back here for me. And then just a little pull on the feet here. Little pull here. Good. And a little pull over here. Pretty darn good. Okay, so we're going to get you up, see how that feels. So again, like that was just a short demo of everything we kind of do over here, but it's not only just getting you out of pain, it's basically trying to give you different functional and correctional movements so you just have a better quality of life. That's the main thing. So usually the first couple treatments, if you were in active pain, we're trying to get you out of pain. But then like my last treatment or two, we will usually go over any kind of stretches, exercises, anything that you could do at home to prevent that. So for example, if we take the, I call it a desk jockey. If you're sitting for 50 hours a week like this on a computer, we're going to get you out of pain. We're going to work on certain muscles and tissues so you can naturally sit up straight. And then we're going to go over different corrective exercises. So for example, the wall angel against the wall, the thread the needle, and just like a couple of different stretches and exercises you could do at home just to prevent this from happening. And I always tell patients like, hey, I love seeing you in here, but I'd rather see you at a Pitt or a Steeler football game, or I'd rather see you at Giant Eagle. And besides being a maintenance patient, I like giving people stuff that they could do at home, just so they're not actively coming in all the darn time. So. All right.
Yeah, Dr. Ross, we were talking about doing this presentation. He was like, I don't know, should I just do it on my hand? And I was like, no, like, you can treat me instead.
Phil said, I will take that. Not a problem at all. Thanks for tuning in, guys. Yep.